A very common concern in patients contemplating getting a penile implant surgery is what happens with the head of the penis. What is called glans? Now let's talk about it. Hello everyone, my name is Jonathan Clavell and I am a urologist and penile implant specialist in Houston, Texas. Today I want to talk about what happens with the glans penis when you get a penile implant. But before we do that, we need to understand the anatomy. This right here is a side view of a penis and its blood vessels. You can see the corporal bodies here on the top and the urethra or urinary channel here on the bottom. The glans or head of the penis is connected to the urethra. When we place a penile implant, we occupy the space inside the corporal bodies. But let's take a closer look at the blood vessels. The blood supply that goes into the penis comes from an artery called the internal pudendal artery. This artery then divides into several branches, and check it out closely. The blood flow that goes into the corporal bodies or corpus cavernosum, which are the chambers where the implant is placed, is called the cavernous artery. On the other hand, the blood supply that goes into the urethra comes from the bulbourethral artery, and this artery supplies the urethra all the way up to the glans penis. But that's not all. There's a second artery that supplies the glans penis, which comes from the dorsal artery of the penis. This one lies close to the skin. To give you a better perspective of things, take a look at this. Let's imagine that the pelvic bone is somewhere in this area. So part of your penis is inside your body and the other part is on the outside of your body. When we place an implant via the penoscrotal approach, we make an incision away from the urethra, close to this spot, on the bottom of the penis, close to here. With the infrapubic approach, the incision is underneath the pubic bone, hence the name infrapubic. This incision is made through here, staying away from the dorsal artery. We then dilate the tissues inside the corpus cavernosum, and therefore that cavernous artery is likely to be affected. But look closely, the end of that cavernous artery does not reach the glans penis. I will repeat that. The cavernous artery does not reach the glans penis, and we need to remember that the blood flow going to the glans penis supplied by the urethra via the bulbourethral artery and the skin via the dorsal artery has remained intact. What does this all mean in layman's terms? This here reveals that the blood supply going to the head of the penis is different from the one going into the shaft. Therefore, there are men with erectile dysfunction who can still bring blood flow to the glans penis. If you have adequate blood flow going to the glans penis, you may still have that after the implant, but that all depends on the health of your blood vessels. If your arteries are all blocked up because of diabetes, high cholesterol, smoking tobacco, or atherosclerosis, radiation therapy for prostate cancer, etc., there is no guarantee that the blood flow can get to the glans penis. Now, you might ask yourself, how can I know if I will have that problem? Well, we need to remember that the only way men without erectile dysfunction see glans engorgement is when aroused. Let me rephrase that. Think about it. The head of the penis engorges with blood only when you're aroused. Without sexual stimulation, the glans is very unlikely to engorge. Therefore, the only way a man with a penile implant will appreciate if they have blood flow to the glans will be when aroused. Let me repeat that again. The head will engorge when aroused. This concept is also important when a man measures his penis after an implant surgery. Measuring your penis the first few days after surgery when you're not aroused and are mostly concerned of the post-operative pain and discomfort is not a good idea. You have swelling around the tissues and the glans is not aroused. So when you wake up after surgery, try not to focus on your size because things may change and improve after you're recovered. Swelling goes down, you have been cycling now regularly, and when aroused, the glans may also engorge and your penis might look bigger. Now, what if I get an implant and don't have good blood flow to the glans? What can I do? The term cold glans is used for a man who has a penile implant and even when aroused, he's unable to engorge the head of the penis. Given that blood flow going to the glans is different, there is a possibility that taking oral medications like sildenafil or tadalafil, that's Viagra or Cialis, again, there is a possibility that these medications might help for glans tumescence. Other things that men have tried is trimix urethral gel or a vacuum erection device with the use of a constriction ring. These medications, be it oral pills or the Trimix gel, not the injection, but the gel, can sometimes help bring blood flow to the urethra. If you have problems with blood flow going to the glands, you can discuss with your surgeon to see if these are viable options for you. What if those things do not help? Not to worry, because there are many men who are not able to get the glands engorged and are still able to enjoy sexual activity with the penile implant. As mentioned in previous videos, you can still get sensation enough to reach orgasm without glands engorgement. In summary, as you saw in today's video, in many occasions the blood supply to the glans penis is different than the one going to the shaft. Therefore, if you get a penile prosthesis, although not guaranteed, there is a possibility that your penis will still feel warm and engorged with blood, which may increase experience and pleasure during sexual activity. If you have an implant and feel like you have cold glands, there are things that you may try. And if you are considering an implant and the fear of cold glands is holding you back from getting one, you need to ask yourself this. Are you satisfied with your ability to gain and maintain an erection hard enough for penetration with whatever treatment option you are on now? If the answer to that is no, then there is a possibility that a penile implant may be a viable solution for your problem. Bring up the conversation with your urologist. And if you're seeking an expert, we're here for you. Remember to like and subscribe if you haven't, and check out the other videos in our channel. I wish you the best of luck in your journey.